this video, we will be discussing all about synovial joint. First, let's define what is synovial joint. Synovial joint in which two bones are separated by a space called joint cavity. Synovial joint, most are freely movable joint. There are salient features that synovial joint have. It includes articular cartilage, capsule, synovial membrane, synovial cavity, synovial fluid, articular disc, ligaments, meniscus, bursa, and the last one is the intra-articular structures. So, let's define it one by one before proceeding to the important that I will discuss, which is the 6 types of synovial joint. So, first, salient of synovial joint, which is articular cartilage. Articular cartilage, it is a hyaline cartilage covering the bone surfaces. Capsule, it is a fibrous capsule lined by a synovial membrane. Synovial membrane, it is attaches to the margins of the joint, surfaces at the interface between cartilage and bone, and encloses the articular cavity. Synovial cavity, it is surrounded by synovial membrane. Synovial fluid, it is a viscous, slippery fluid rich in albumin and hyaluronic acid and similar to the raw egg white. Articular disc, it is a circular rim of fibrous cartilage between articular surface of two bones. Meniscus is an incomplete rim of white fibrous cartilage between articular cartilages. Shock absorber and enhancement of congruence, protection of edges, weight distribution, and facilitation of movement. The bursa, it is a lubricating device, consists of a closed fibrous sac present wherever tendon rub against bones, ligaments, or other tendons. Tendon sheath and bursae. It is a cylinders of connective tissue lined with synovial membrane and wrap around a tendon. The last one is the intracapsular structures, and it look like the intracapsular structure. So here are the types of synovial joint that I would be discussed one by one. It is classified according to the arrangement of the articular surfaces and types of movement. First, we have the plain joint. Second, the hinge joint. Third, the pivot joint. Fourth, the condyloid joint. Fifth, the saddle joint. And last, the ball and socket joint. So, let's discuss it one by one. What is the 6 types of the synovial joint? First, we have the plain joint. It is supposed articular surfaces are flat, allowing bones to slide on one another. It is a sternoclavicular and acromyoclavicular joint. And this is my improvised model of plain joint. This is our carpal bones, our metacarpal bones, our this one that I highlighted, this is what we call our plane joint. As I move closer, as you can see, the plane joint. So, let's move on to the hinge joint. It resembles hinge on door, flexion and extension possible, elbow, knee, and ankle joint. So, this is our hinge joint. This is our humerus, our radius, our ulnar. And if we talk about hinge joint, in this part, we can find it the hinge joint. So, let's proceed to the condyloid joint. Condyloid joint, these are also known as bicondylar joint. Their articular surfaces consist of two distinct condyles, in which one is fitting into a concave surface of the other bone. These joints mainly permit the movement in plane around a transverse axis. So this is my improvised model of condyloid joint. This is our trapezium. Our first metacarpal, our trictum brother, our hamate, our metacarpal also, and our proximal phalanx. And as you can see, this part, I highlighted it because we can find the condyloid joint in this part. As I move closer, as you can see, the highlighted one, that is what we call the condyloid joint. So, let's proceed to the pivot joint. Pivot joints are formed by a central bony pivot surrounded by an osteoligamentous ring. Movements are permitted in one plane around the vertical axis. Example of this type are superior and inferior radio-ulnar joint and the atlanto-axial joint. So I have here the improvised model again and again of pivot joint. If it talks about pivot joint, we can find from here to here. This is what we call our pivot joint. So, let's move on to the saddle joint. Each articular surface is shaped like a saddle, concave in one direction and convex in the other. So, I have here the improvised model again of saddle joint. As what I have mentioned, this is our trapezium, our metacarpal of thumb. As you can see, this green circle, this is what we call the saddle joint. As you can see that is what we call our saddle joint. So, let's move on to the last one, which is the ball and the socket joint. Socket depend by acetabular labrum. Blood supply to head of femur found in a ligament of the head of a femur, joint capsule strengthened by the ligaments. So, this improvised model, the last one that I made, which is the ball and the socket joint. As you can see, this is our ilium part. This one, our ilium part, and this is our femur. And also, this one that I encircled or highlighted, this is what we call our ball and socket